This is Honu Hurd discussing getting back to school with the Fairfax County Public Schools and the students coming off their New Year's winter break. We keep seeing the headlines about the Omicron variant running rampant through the population, how parents are cautious about sending their kids back to school after the holiday break, how teachers are concerned about the safety of classrooms. And of course, we see in the news how children are being hospitalized at record rates. Using data provided by the Virginia Department of Health, I must throw my BS flag and state emphatically that this is utter and complete nonsense in Fairfax County. The flu is back in Virginia. Yes, unlike last year where the flu disappeared, this year we've had 4 weeks of widespread flu cases in the state of Virginia, so classified by the Virginia Department of Health. Now, what we're seeing are a lot of cases, including with students, but very few hospitalizations. The problem we have now is not only is the flu back, but Omicron's coming on, and they look almost exactly alike. Runny nose, headache, fatigue, sore throat. Could be one, could be the other. Don't know. They get tested. Now, here in the Fairfax Health District, we do have a pretty high vaccination rate. Right now, people 18 years and older, roughly 80%. Have been fully vaccinated. People 18 years and older have an 88.6% partial vaccination rate. And frankly, in school-age kids, they also have a high vaccination rate. Kids 5 to 11 have 43%, 12 to 15, 88%, 16 to 17, 93%, 18 to 24 years old, 91%, at least partially vaccinated in the Fairfax Health District. The next area I want to touch on is cases amongst the school kids in Fairfax County Public Schools, and frankly, this is kids all the way across the Fairfax Health District, which comprises Fairfax City, Falls Church, and Fairfax County. And keep in mind, this is everyone in FCPS, this is homeschool, this is private schools, etc. So these are all the cases that have happened. Some of the things that are worth noting here are that you don't see any exponential spread of this virus. You would think that one person would get it, they'd give it to 2 or 3 people, they'd give it to 2 or 3 people, etc. You really don't see that. It's been very flat. You're also seeing spikes recently that coincide with the widespread flu outbreak, and coincidentally enough is occurring when the kids are not in school. So let's keep some of these numbers in perspective. For instance, when you look at December 28th and you see 258 kids ages 10 to 19, you're talking everything from 6th grade to a freshman in college, and this comprises all of 0.17%. That's right. So you'd have to sustain this for 6 full days before you'd affect 1% of this population, or close to 6 days. So to think that this thing is running crazy and we need lots of mandates and staying at home is absolute nonsense. Review the numbers for yourself, but there they are just for you to look at in a nice graphical way. Let's now look at the hospitalizations, because we keep seeing the news about kids being hospitalized at record rates. So in the Fairfax Health District since November 24th, there have been 1 person from age 10 to 19 and 2 from 5 to 9. That's 228,000 people, 3 hospitalizations over 35 days. So where these news organizations are getting this numbers from about the surge of hospitalizations amongst kids, I have absolutely no idea. Now, some folks will say, why am I picking November 24th as the start date? It's because the Virginia Health Department data seems to have gotten reset between November 23rd and 24th, and the numbers went way down between those 2 dates. So I'm picking that as my start date. But as you can see, we're not seeing very many hospitalizations amongst pediatric kids or school-age kids in the Virginia Fairfax Health District. Looking at deaths in the Fairfax Health District is really the tell that this virus is not something that kids should worry about, frankly. Now, if you're an older person, 80 or older, you should be shaking in your shoes. But for kids, not so much. During the entire pandemic, and we're talking about data going back to April of 2020, there's been only 1 infant death in the Fairfax Health District. Now I'll say infant because it was someone 0 to 4, August 28th of 2021, when there were only 1,000 cases in the entire state of Virginia being reported at the time. But going all the way back to April, for ages 0 to 19, over 300,000 people in the Fairfax Health District, there's only been one death, which lines up pretty much with what you would expect to see with pediatric flu deaths. Our health district accounts for roughly 13% of all the kids in the state of Virginia. There are roughly 6 flu deaths, pediatric flu deaths per year. So yeah, you would expect over 20 months that we would see one flu death in this age group. So again, parents shouldn't be that worried about this virus killing your kids, despite what you see in the news. I'm a big fan of knowledge is king and the do your own homework. You'd expect it of your kids, so you parents should be doing it yourselves. I've attached here and shown on the screen a link to the Virginia data sets that are available for COVID-19 that you can look at. There's lots of different ways they've sliced up the data. It's https datavirginia.gov, and just go ahead and look to see what they've got. Sort, look, become knowledgeable on your own. Stop listening to the news media, the teachers' unions, or even the administrators of FCPS. Remember, these guys have pretty much failed at everything they've ever attempted, so do your own homework and speak up. In Fairfax County, there's absolutely no reason to consider the pausing or stoppage of in-person learning or cancellation of any extracurricular activities. Wouldn't be stopped for the common cold, flu season. It should not be considered due to Omicron or whatever the next variant's going to be called for the SARS-CoV-2 virus. Right now, the symptoms are proving relatively mild, and frankly, the data doesn't support anything but in-person learning. The real numbers don't support it. The parents need to push back on school administrators and unions who propose anything other than business as usual. Vaccination rates are high. Masking is already mandatory. The data is favorable, even with a surge of illness that mimics the flu season. And as parents, it's really time for us to say, when is it enough? Let's get back to the old way and focus on education instead of worrying about ghosts around every corner that don't exist. Let's have a great school year, and let's have the students have those great school years in school.